Hey, what's up? I'm Dr. Atasha Jordan. Welcome to my YouTube channel. Thank you for checking it out. I am so glad that you found my page. I am a Christian psychiatry resident, and one of my biggest goals is to be able to share about Jesus and mental health. Oh yeah, totally forgot to mention a really important disclaimer. This video, it's meant to inform and to educate. It is not meant to treat or to diagnose. So going into now the last section of this talk before we get into question and answer is the treating of depression. So some of the options that I want us to consider are faith, meds, and therapy. And what I will say is that all three of these together, neither alone. So from a strictly clinical standpoint, doctors will tell you medication and therapy together is the ideal gold standard for the treatment of depression. And I will say, as a Christian doctor, that faith, medication, and therapy, all three of those together, will be the ideal treatment for depression. So here, as I said, we have these three options, and I'll kind of go into what these look like specifically. So when we're thinking about treating depression, first there's faith. What I want us to recognize is that the role that faith plays in depression is the spiritual health standpoint. And what I've been talking about today is this idea that spiritual health and mental health are different, but ultimately they are intertwined. And when your spiritual health is intact, you give yourself the best chance to also then improve your mental health. So what does it look like for faith to play an important role in your mental health? Mostly your faith is going to bolster the spiritual health, which honestly, even from a clinical standpoint, doctors will say that these different components of how faith impacts your spiritual health are actually some of the things that help people to improve best clinically from depression. So with our faith, what that helps us to do is to lean on church community for support. In folks, generally speaking, Christian or not, we always say that leaning on supports is one of the best ways to help with recovery. So as a Christian, thinking of your church community, whether that's for me, it's like young adults. I love the young adults group, the created singing group, praise and worship, even with the women's ministry, to be able to lean on people to help you, to support you through challenging times. I think the next one is being able to discuss challenges with religious leaders. So having someone you can confide in, again, Christian or not, but specifically here when you're Christian, to be able to trust that your religious leaders are going to be there to support you, but then also not to gossip about your experiences. I think that's important as well. Our faith, reading the Bible. So I just went through a bunch of verses, especially the ones where I talked about how our spiritual health is part of our self-purpose, our identity of self, and our connection with our purpose. Reading the Bible is integral because you're going to find encouragement to help you through the difficult times and help you through your depression. Getting involved in ministry. So actually one of the things that we always recommend to patients is find things to do. One of the most helpful ways to help guide someone through depression is to be able to not be isolated, to not be kind of just sitting in the house doing nothing. So as a Christian, your faith is improving your mental health because you're being able to get involved, you're connecting with people, you're finding encouragement that is connected with your connection to God, your connection to others, and your sense of self and purpose. Then, so with the faith, that's where now we think clinically. So with medication, and I think a lot of the times people are afraid to take medication for depression. And it's interesting to me because honestly, there's still so much stigma that exists, whether it's within the Black community, within churches, within just all communities, honestly, that against having a mental illness, and that means that there's something wrong with you. And what I really just want us to be able to talk about is that mental illness is no different than your cancer. It's no different than your diabetes. It's no different than any endocrine disease you can have. It's an illness, and it's an illness that we have treatments for that people are able to see like marked improvement in these symptoms. So examples here on the left of antidepressants, these are examples of SSRIs, which are selective serotonin reuptake inhibitors. So I've been mentioning these different neurotransmitters, and what these medications actually help to do is to help to increase the levels of some of those neurotransmitters in your brain so that those chemicals which actually help to induce and help to improve happiness, these medications are specifically targeting those chemicals to increase those levels. So some of these here are the SSRIs, so selective serotonin reuptake inhibitors. Some are SNRIs, selective serotonin and norepinephrine reuptake inhibitors. And what I want to talk about is the benefits and side effects, because any doctor, anytime, for any medication you take, should be telling you benefits and side effects, because as we know from especially all those commercials, that every single medication has side effects, and you have to think about the risk benefit, the risk and benefit of taking these different medications. So here are the benefits of these different types of, whether it's Zoloft, Lexapro, Celexa, these antidepressants, improve mood. When you're depressed, one of, as I said before, the main criteria, it's you're either having hopelessness, depressed mood, or loss of interest. And because these medications help to change the chemical balance in your brain, you can have improved mood, you can sleep better, you start eating better. The same lady that I talked about that I treated very recently, we started her on an antidepressant, and actually one of the antidepressant we chose for her, one of its side effects is increased appetite, which was perfect because she had lost 50 pounds and needed to gain weight. So that's one of the benefits that can occur with antidepressants. And increased energy. And a lot of people will say that they felt like they were in a cloud before starting on an antidepressant, and now they have clarity to be able to just go back to their regular level of function once they're steadily on an antidepressant. And something I'll throw in is, I think the other thing is people are afraid that they'll have to take the medication forever. And honestly, you might. Some people who have diabetes have to take their insulin or take metformin or glipizide or all these other medications. You have to take it every day for the rest of your life. But if you're able to make lifestyle changes, so whether that's you're exercising more or you're improving your diet, you might actually have to like stay on that medication for a shorter period of time. So similarly with depression, sometimes someone might be on, let's say, an antidepressant for about a year or so, and then their doctor will start to kind of slowly decrease the dose to see how they do, if they can succeed without it going forward. Or some people, if you're in the category where you have recurrent depression, might need to just stay with the medication, just as someone with diabetes might need to stay on their insulin for a lifetime. And then, as I mentioned, I have to talk about the side effects as well. So depending on which antidepressant you start, you can have nausea, weight gain, decreased libido, dry mouth. These are some examples of some of the side effects that you can have. But the conversation that will be important for you to have with a doctor is weighing the risk and benefit of these side effects compared to the benefits that you can have. And that's what I really want to be able to emphasize here. And then the last component of treatment for depression. So we talked about faith, we talked about medications, and lastly, we're talking about therapy. So when we're thinking about depression and therapy in particular, I think sometimes people are afraid of therapy and what does therapy mean? What does therapy look like? There are actually so many different types of therapies. And in some ways, the counseling that you might receive from a religious leader or a leader at church is therapy. That counseling tends to fall into the category of supportive psychotherapy, meaning that someone's there listening to you, they're able to hear your thoughts, hear your concerns, they're supporting you, and whether that's kind of giving you advice to help with your self-esteem or to help you learn skills to cope and deal with challenges better. That's kind of more so what like religious counseling is, unless the person is trained in psychology and able to then give other types of therapy. So that could be cognitive behavioral therapy. And with cognitive behavioral therapy, what that talks about is the interconnection between your behavior, your thoughts, and your emotions, how being able to fully understand those three components of ourselves, we can better kind of adjust our actions or adjust our thoughts or our emotions to really allow ourselves to be in sync. So that's one of the therapies that exists for depression. And then on the far end of the spectrum, another type we have is psychodynamic therapy. And that's really where the therapist is really able to pinpoint and work on finding the problem areas in your life. So whether that's lifestyle or environment or working through past traumas or things of that nature that can help you to better recognize and gain insight to your behavior, your feelings, and your thoughts, and then working towards you being able to better cope with the challenges that arise. So I hope that kind of me being able to lay these out of just recognizing spiritual health, mental health, they're different, interconnected for sure, but different. Talking about the fact that how do you recognize what depression is, and then what are the different ways that we can treat it, especially as Christians, I hope that this for you is enlightening, and I hope that it brings also raises up some questions. Some of the last things I want to talk about. So these are adjunct therapies, I would say. So a physician is never going to say that herbal remedies, acupuncture, exercise, meditation, massages, guided relaxation, yoga, that these things in and of themselves can treat depression, but they can help you to feel better and help bolster the medical, the therapy, and faith-based experiences that you have, or those treatments in depression. So just to kind of wrap up on the formal part of this, I really want to be able to kind of summarize a few things. So first, spiritual health, mental health, they are different but very much intertwined. I want you guys to be able to be aware of mood and behavior changes in yourselves and in loved ones, because at the end of the day, depression is impairing. It impacts us in ways where we can't function the way that we want to. And on the worst, the most extreme end of the spectrum, leads to suicide, leads to people taking their lives because they feel so hopeless and so down that they don't see any way out of it. But then I want us to recognize that it's treatable. So I don't want us to ever be afraid of mental illness in a way that this is something that your life is over, because that's not the case at all. Depression is treatable. There's medication, there's faith, and there's therapy that can help us to successfully get through an experience of depression. And as I mentioned, just the faith, meds, and therapy, and how important those all are together. So before we hop into Q&A, I just have a couple of things I wanted to talk about. There are a few additional resources if you ever wanted to look up to learn more about what I said. I mentioned my blog earlier, atashajordan.com. I have the Psychiatry in 60 Seconds series there. But here are some national resources as well for you to be able to learn more. There's the Substance Abuse and Mental Health Services Administration. Here's their website and number if you ever wanted to reach out. The National Suicide Prevention Lifeline. So if at any time you ever felt like you wanted to end your life, this is a number that you could reach out to, and they have trained clinicians who are there to support you. And a Philly-specific outreach is Healthy Minds Philly. You can find healthymindsphilly.org. Additionally, has resources that go obviously far beyond even just depression, but across the spectrum of mental illness. And for me, if you ever wanted to get in contact with me, here are the different ways that you can reach me. I am on social media a lot. I'm trying to actually be on there less, but I'm on there a lot. Twitter, Instagram, Pinterest, you can reach out to me on either of those. My email address, you can reach me at admin@atashajordan.com or on my website, as I mentioned before. And then lastly, I actually wanted to share this. So you can't really see it. Ooh, I'm going to show. I have this like super sweet sweater. It says Jesus plus therapy, because I really do think that in order for us to succeed when it comes to our mental health, we need Jesus and we need some therapy. I could add some meds in there too. But if you wanted to ever get any of this merchandise, I have sweaters, mugs, t-shirts at teespring.com/Jesus plus therapy. There's a QR code there if you ever wanted to get anything. So if you feel like the content of this video kind of resonates with you, you think that you might be experiencing some of these symptoms, you know someone else who might be experiencing the symptoms, I really encourage you to reach out to a medical provider, whether that is your primary care doctor, a psychiatrist, a psychologist, someone. And if you are feeling that you are in crisis, you can always reach out to 911, go to your local emergency department, and they would be able to help you through a mental health crisis. Much love. And I hope you enjoyed the video. If you haven't already, make sure that you subscribe below, you like, you share, do all of those great things to make sure that we get the word out, because we don't want Christians falling in that category of folks who are not getting treated for their major depressive disorder, because it's treatable just like any other illness.